So you've seen the second part of my interview with Helen and Lisa, and in that video we talked about the specimen types. So I wanted to give you a rundown of what an actual clinical microbiology might look like. So this diagram here is from a publication where it talks about how you might plan and design a laboratory for the different types of samples we receive. In the light blue, you can see that we have an area where all the samples come to, the central processing area. And from that area, we then send our samples off to the various parts of the laboratory. For instance, we talked about blood cultures, and that has specialised machinery. If you look over to the right, we've got a molecular stat lab. So there you might do some on-the-spot testing. In the centre, you have your traditional micro, and that's where we do a lot of the processing of our agar plates, our microscopy, and where we grow the organisms on the agar plates. Now, once we have the colony growing on the agar plate, we send it off to what's called the MALDI-TOF, which is a machine that looks for the protein fingerprint, and it's very good at giving us a diagnosis of our colonies. We'll also have below the MALDI-TOF, you can see an area devoted to doing susceptibility. So in our last interview part, you saw some susceptibility testing for the antibiotics, and that's a very important area to make sure that patients are on the right treatment. Down the bottom, we've got some molecular diagnostics, so we could be sending swabs there for things like herpes, and you can see that this particular lab has actually grown to have another area of molecular diagnostics. At the moment, as Lisa mentioned, we're getting a lot of molecular testing for coronavirus. So that is our main microbiology setup. Now, we talked about all those agar plates, and one of the problems of a microbiology lab is the amount of waste that it generates, and also we have to consider safety when dealing with our microbiology samples. So I'll just take you through a little bit on microbiology safety. If you're going for an interview for a technical job in a lab, they'll probably ask you what is important when it comes to PPE in a laboratory, personal protective equipment. And so you should say that gloves should always be worn when dealing with blood and body fluids. This is very important. When you're dealing with the agar plates, that's not a risk. The main risk is our blood and body fluids. The other risk that we face in microbiology is that if we have a sputum sample, that's the pus that people cough up from their lungs, this may contain an agent like our tuberculosis. And in the previous plan, there was that BSL laboratory, a biosafety level 3 laboratory. That's where we process our most dangerous organisms. So they're the basics of safety that you need to know for your diagnostic microbiology. And as I mentioned to you, we have a lot of bulky samples because we're using our agar plates. So this is generating a lot of medical waste, and it's quite costly to process this medical waste. That's why a lot of future hope is pinned on molecular testing to speed up our diagnosis and also to speed up our testing for susceptibility. One of the problems with susceptibility testing, though, is that bacteria can develop almost an infinite variety of different ways of becoming resistant to antibiotics. And so this is very challenging when it comes to developing tests for our microorganisms. That's all I have to talk to you about. I'll get you to watch the third part of the interview now with Lisa and Helen. And after that, I'll pop up a couple of case studies for you to work through to apply your knowledge of microbiology specimens and how we process them in the laboratory.